Computed tomography, commonly known as CT, has transformed the landscape of medical imaging. The term tomo means slice, and graphy means picture, which perfectly describes how CT works. It creates detailed cross-sectional images of the body. CT scanners use X-rays to measure how much radiation passes through an object, and this data is then converted into a density scale to reconstruct visual images. Since 1975, rapid advancements in computer technology have enabled the widespread use of newer generation CT machines, making them an essential tool in modern diagnostics. The CT scanner is a sophisticated machine, with its core component being the X-ray tube housed inside a square structure called the gantry. When a patient is scanned, the relevant body part is positioned within the gantry's central hole. The scanner then rotates around the patient, capturing multiple images from different angles. These images are typically obtained in the axial plane, providing cross-sectional views that allow for detailed evaluation of both soft tissue and bone. This setup is crucial for accurate and comprehensive imaging. CT scans can be performed using various techniques, each tailored to specific diagnostic needs. Plain studies are done without contrast, while contrast-enhanced studies use special agents to highlight certain structures. High-resolution scans provide greater detail, and reconstructions in coronal and sagittal planes offer additional perspectives. These techniques allow clinicians to assess different tissues and structures with remarkable clarity, making CT a versatile tool in medical imaging. Modern CT scanners are equipped with advanced software that enables 3D imaging, multiplanar reconstructions, and real-time visualization. Spiral CT and ultra-fast electron gun CT represent significant technological leaps, allowing for rapid image acquisition and improved diagnostic accuracy. CT angiography and dental CT, including cone beam computed tomography, CBCT, further expand the capabilities of CT imaging, making it possible to visualize complex anatomical structures in unprecedented detail. Compared to traditional radiographs, CT scans offer several advantages. They require no special patient preparation and provide quick imaging, reducing motion artifacts. The images are contiguous, allowing for precise localization of lesions and their extent. CT is especially valuable in emergencies, trauma cases, pediatric patients, and oncology, as scan times are short and information transfer is rapid. The ability to view structures in 3 dimensions and discriminate between tissues with small density differences makes CT an indispensable tool. Despite its many benefits, CT scanning has some drawbacks. It requires patient cooperation, and forceful respiratory or body motion can degrade image quality. There is also a medical radiation burden and the possibility of allergic reactions to contrast media. These limitations must be considered when choosing CT as a diagnostic modality, especially in vulnerable populations such as children and those with allergies. Computed tomographic scanning is widely regarded as the gold standard in diagnostic radiology. Its ability to visualize complex bony anatomy without superimposition and provide high-contrast discrimination of soft tissues has revolutionized medical imaging. CT scans are invaluable for diagnosing a wide range of conditions, from trauma to oncology, and their accuracy and reliability have set a new benchmark in radiology. Axial CT scans are particularly useful for imaging the maxillofacial area. These cross-sectional images provide detailed information about the bones and soft tissues of the face, aiding in the diagnosis and treatment planning for various conditions. The ability to obtain sequential images allows clinicians to assess the extent of lesions and anatomical relationships with precision, making axial CT a cornerstone in maxillofacial imaging. Maintaining records of CT scans is essential for patient care and follow-up. Images are stored on radiographic films, photographed from monitor screens, or digitally archived. Typically, CT scan records are kept on large sheets of film, with multiple images per format. Each image is labeled with the patient's details, ensuring accurate documentation and easy retrieval for future reference. Axial sections, while valuable, have certain limitations. They lie parallel to the surfaces of interest and may miss areas of contact or regions exposed during surgery. These images often require interpretation by a diagnostic radiologist, as they bear little resemblance to physical examination findings. In complex anatomical areas, axial CT may not provide optimal information, necessitating additional imaging in other planes. Coronal and sagittal sections complement axial imaging by providing views that correspond to clinical examination angles. Coronal sections are particularly useful for visualizing the maxillofacial region, but they require additional scan time and radiation exposure. Sagittal sections offer further information, especially in cases where detailed anatomical relationships are needed. Together, these planes enhance the diagnostic capabilities of CT scans. The advent of 3D imaging has revolutionized CT scans. By stacking 2D slices sequentially, a three-dimensional matrix of digital information is created, representing the scanned object. These 3D images can be rotated, split, and manipulated to generate individual views of different tissue types. The introduction of 3D image display has eliminated the need for mental reconstructions, providing more spatial information than ever before. High-resolution axial CT scans serve as the input for 3D reconstruction programs. Siemens scanners, for example, use specialized software to convert 2D data into 3D images. Depending on the number of slices, reconstruction time can vary, but the resulting images closely resemble photographs of anatomical structures. These 3D images are invaluable for surgical planning, education, and quantitative evaluation. 3D CT images offer several outstanding features. Surgeons can easily assimilate complex anatomical relationships, as the images resemble anatomic dissections. The technique delineates abnormal bony morphology, provides easy interpretation, and facilitates efficient storage. Pre-selected views are automatically generated, simplifying the reconstruction process and aiding in surgical planning. 3D CT scans allow for accurate documentation and quantification of lesions, yielding true life-size images. This capability is essential for monitoring post-operative outcomes and evaluating the effectiveness of treatments. The technique enables quantitative post-operative evaluation and follow-up, providing clinicians with reliable data for patient management. Radiation exposure in CT scans is a concern, but modern techniques have minimized risks. The use of pencil beams and advanced technology ensures that radiation levels do not exceed those of conventional radiography. Secondary radiation is kept to a minimum, making CT scans safer for patients while maintaining diagnostic quality. Dental imaging has seen significant advancements with the introduction of tomography and panoramic imaging. Tomography isolates areas of interest, while panoramic imaging provides comprehensive views of maxillofacial structures. However, 2D images have inherent limitations such as magnification, distortion, and superimposition, which can affect diagnostic accuracy. Cone beam computed tomography, CBCT, is a variation of traditional CT that uses a cone-shaped X-ray beam and a rotating detector panel. CBCT generates images at lower radiation doses and faster processing times, without compromising diagnostic quality. It is particularly useful in dentistry, providing 3D images of teeth, jaw, and surrounding structures, and is considered the gold standard for oral and maxillofacial imaging. CBCT scans involve the X-ray tube and detector rotating around the patient's head and neck, capturing data with a cone-shaped beam. This data is used to reconstruct a 3D image of the teeth, mouth, jaw, and ENT region. Contrast-enhanced CBCT images allow for multiple views of the maxillofacial complex with a single scan, providing anterior, coronal, and axial images, as well as 3D reconstructions. CBCT offers several advantages over traditional imaging methods. There is no superimposition, measurements are one-to-one, and there are no geometric distortions. CBCT uses relatively low ionizing radiation and provides 3D representation of hard tissues with minimal soft tissue information. The compact CBCT unit is ideal for dental setups, and images can be rotated to visualize multiple planes and angles. CBCT is widely used in oral and maxillofacial surgery to investigate jaw pathologies, assess impacted or supernumerary teeth, and evaluate their relationship to vital structures. It is also used for pre- and post-surgical assessment of bone graft sites, evaluation of osteonecrosis, and assessment of paranasal sinus pathology. CBCT provides thorough pre-treatment evaluations for patients with obstructive sleep apnea and aids in surgical planning. CBCT is invaluable in evaluating maxillofacial trauma, especially for managing midfacial and orbital fractures. It allows for intraoperative visualization of bones and navigation during procedures involving gunshot wounds. CBCT is also used to plan orthognathic and facial surgeries, providing detailed visualization of dental surfaces and interocclusal relationships to augment 3D virtual skull models. CBCT is particularly useful in cases of cleft lip and palate deformities. With advanced software, clinicians can visualize post-treatment aesthetics and evaluate the outline of the lip and bony regions of the palate. These images can be rotated to view multiple planes and angles, providing information that is not available with 2D radiography. CBCT is a crucial tool for diagnosing diseases and dysfunctions of the temporomandibular joint, TMJ. It allows for examination of the joint space and the true position of the condyle within the fossa, revealing possible dislocation of the joint disc. CBCT's accuracy and lack of superimposition enable measurement of the roof of the glenoid fossa and visualization of soft tissue around the TMJ, reducing the need for MRI. CBCT has become the established method for imaging jaw anatomy prior to dental implant placement. In the axial plane, metal artifacts from tooth fillings are kept in the occlusal plane, preventing distortion of the jawbone. This allows for accurate display of vertical and buccolingual dimensions, assessment of alveolar ridge anatomy, and selection of proper implant length and diameter. Life-sized cross-sectional and panoramic images can be obtained. The workflow of a CT scan involves patient positioning, image acquisition, and data processing. The patient's body part is stabilized, and high-resolution axial slices are obtained. These images are then transferred to a viewing console, where they are interpreted by a radiologist. The process ensures accurate and detailed imaging, essential for diagnosis and treatment planning. CT scan images are stored on radiographic films, CDs, or printed on paper. Large sheets can hold multiple images, and digital storage allows for easy retrieval and sharing. Proper labeling with patient information is crucial for maintaining accurate records and ensuring continuity of care. Interpreting CT scans requires expertise, as the images may not directly resemble physical examination findings. Diagnostic radiologists play a key role in analyzing sequential images, especially in areas of anatomical complexity. Their interpretation guides clinical decision-making and ensures accurate diagnosis. CT scans can miss areas of interest, especially if sections lie parallel to surfaces of interest. During surgery, surfaces exposed are rarely oriented axially, which can limit the utility of axial images. Additional imaging in coronal or sagittal planes may be required to obtain comprehensive information. Coronal imaging is beneficial as it corresponds to the angle of vision used during clinical examination. It provides additional information about the maxillofacial region, but requires more scan time and radiation exposure. Despite these drawbacks, coronal sections are valuable for detailed anatomical assessment. Sagittal imaging is used when additional information is needed, especially in complex cases. It provides a side view of anatomical structures, complementing axial and coronal images. Sagittal sections are particularly useful for evaluating the temporomandibular joint and other intricate regions. 3D CT images can be stored on large sheets, CDs, or printed on paper. The storage format depends on the number of images and the intended use. Digital storage allows for easy access, sharing, and archiving, making it convenient for clinicians and institutions. 3D CT images can be rotated to view anatomical structures from different angles. This feature allows clinicians to reconstruct surfaces from oblique projections, revealing regions inaccessible to other radiographic procedures. Rotation enhances the diagnostic value of 3D imaging. 3D CT images are invaluable for surgical planning. Surgeons can review complex anatomical relationships, delineate abnormal morphology, and assess the relative position of structures. The technique provides information about unilateral or bilateral involvement of lesions, aiding in precise surgical intervention. 3D CT images serve as excellent teaching aids and communication tools. They provide clear, life-size representations of anatomical structures, facilitating understanding among students, clinicians, and patients. The images can be used for education, patient counseling, and interdisciplinary collaboration. Radiation safety is a priority in CT imaging. The use of pencil beams and advanced technology ensures minimal exposure, comparable to conventional radiography. Proper protocols and equipment maintenance further reduce risks, making CT scans safe for routine use. Dental CBCT technology utilizes a compact unit suitable for dental setups. The X-ray tube and detector rotate around the patient's head, capturing data with a cone-shaped beam. This technology provides multiple views of the maxillofacial complex, including anterior, coronal, and axial images, as well as 3D reconstructions. CBCT images are self-corrected for magnification, producing orthogonal images with a practical 1:1 measuring ratio. This accuracy makes CBCT a more reliable option than panoramic and traditional 2D images, especially for dental implant planning and assessment of jaw anatomy. CBCT is used for thorough pre-treatment evaluations of patients with obstructive sleep apnea. It helps determine the appropriate surgical approach by providing detailed images of the airway and surrounding structures. This information is crucial for planning effective treatment and improving patient outcomes. CBCT is essential for investigating and managing maxillofacial trauma, especially midfacial and orbital fractures. It allows for post-fracture assessment and intraoperative navigation, ensuring accurate diagnosis and effective management of complex injuries. CBCT is invaluable for planning orthognathic and facial orthomorphic surgeries. It provides detailed visualization of interocclusal relationships and dental surfaces, augmenting 3D virtual skull models. This information is vital for precise surgical planning and achieving optimal outcomes. With advanced software, CBCT allows for post-visualization of soft tissue, helping clinicians appreciate post-treatment aesthetics. This capability is particularly useful in evaluating the outline of the lip and bony regions of the palate in cases of cleft lip and palate deformities. CBCT makes it possible to examine the joint space and the true position of the condyle within the fossa, which is instrumental in revealing possible dislocation of the joint disc. Its accuracy and lack of superimposition allow for measurement of the roof of the glenoid fossa and visualization of soft tissue around the TMJ, offering a workable diagnosis and reducing the need for MRI. CBCT is the gold standard for imaging jaw anatomy prior to dental implant placement. It allows for accurate display of vertical and buccolingual dimensions, assessment of alveolar ridge anatomy, and selection of proper implant length and diameter. Life-sized cross-sectional and panoramic images can be obtained, ensuring precise implant placement. Computed tomography and cone beam CT have revolutionized medical and dental imaging, offering unparalleled detail, accuracy, and versatility. From diagnosing trauma and pathology to planning surgeries and implants, these technologies continue to advance, providing clinicians with powerful tools for patient care. As software and hardware evolve, the future promises even greater capabilities, making CT and CBCT indispensable in modern healthcare.